A concerning new report on the number of Baker Acts involving Florida children. Recently released state data shows that the number of children sent for involuntary psychiatric exams last year has now reached a historic high. That's according to USF's Center for Baker Act Reporting, which released a report earlier this week covering fiscal year 2020 to 2021. Contact 5 investigator Katie LeGrone is tracking the troubling trend, seeking context and clarity from experts and advocates who for years have raised the alarm about Florida's overuse of the Baker Act on kids.
It's a sobering sign of Florida's mental health crisis among children. More involuntary mental health exams are being done on kids in Florida than ever before, the number exceeding 38,000 between 2020 and 2021, according to the latest annual report released by USF's Center for Baker Act Reporting. That's an increase of 77% in just the past decade, and equivalent to an average of just over 100 kids a day who in 1 year were mentally examined against their will in Florida.
I am not surprised at all. In fact, I was a little concerned or dismayed that there was this false narrative happening during the pandemic that our children were doing well.
April Lott knows the state's troubling trend of Baker acting children. The executive director for a trauma treatment center in Clearwater, she also served on the state's Baker Act Task Force, a group created by the legislature in 2017 to study why so many kids in Florida were being involuntarily examined under the state's Baker Act law.
The sole mission was to figure out how to bring these Baker Act numbers, specifically as it relates to children, down. But the numbers are still going up. So does that mean that the state has failed?
It's a good question. I don't know that the state has failed. I think that the dynamics have shifted on us.
In fiscal year 2019-2020, the state had reported its first ever decrease in Baker Act exams among kids. That drop chalked up by experts as an anomaly from a year dominated by COVID shutdowns, school closures, and distance learning. But Lott believes these latest stats reflect the pandemic's aftermath.
Our children are hurting. They're struggling. Their behavior is telling us that. They are using words like suicide and death by suicide. The pandemic in particular has exacerbated that crisis in ways that I don't think people anticipated.
Still, Lott also believes the Baker Act is overused on kids, especially at school. Where starting this school year, districts are now required to report the number of Baker Acts they initiate on kids, and parents must be notified before their child is Baker Acted on campus.
In Florida, we use the Baker Act sort of at the first sign of a problem when we should be using it as a last resort.
Sam Boyd is a senior attorney with the Southern Poverty Law Center. Last year, the nonprofit issued this scathing report and sued the Palm Beach County School District, saying the district illegally used the Baker Act on students, some as young as 5 years old. The district has since adjusted some of its Baker Act policies. The lawsuit remains pending, but Boyd believes the latest numbers show despite millions in efforts to treat children before crisis, the state is still failing.
It's really, the worst way of dealing with a kid with an emergency psychiatric challenge. And we really got to be thinking about all the ways we can, all the off-ramps that we can take before we get to a place where we feel like we need to institutionalize a child.
It is traumatizing, and I would argue in the vast majority of cases unnecessary.
So is it time for Florida to do away with the Baker Act?
That is an excellent question. And I want to say that the 5-year plan, the 10-year plan should in fact get very close to doing away with the Baker Act. But in order to get away from the Baker Act, eliminating the need for a Baker Act, we have to invest upstream.
This year, Mental Health America ranked Florida 49th in the nation for access to mental health care. In the spring, the state legislature approved more than $100 million in reoccurring annual funds for mental health, an historic move for the state. I'm Katie LeGrone reporting.
We're taking a closer look at the data here in our 5-county area. We looked at the total number of people Baker acted in each county, and what % of those incidents involved someone under 18. In Palm Beach County, roughly 19% of Baker Act incidents involved children, 22% in Martin County, 25% in St. Lucie and Indian River counties. In Okeechobee County, now that jumps to nearly 40% of all Baker Acts involve minors. That's double the state average.